What did I just see? What is going on?
Detected that at 62, you faced your girlfriend's betrayal, workplace setups, and a relative's death. Desperate binding conditions met. Binding Med Library System. This system contains all historical and global medical knowledge. System reminds host. It holds all global medical knowledge. Complete system tasks. To acquire skills. System reminds host. May you rise from adversity. It holds all global medical knowledge and reach the medical pinnacle.
System? Me at 62? But I'm only 26. Was everything I saw a vision of the future? The system came 40 years early to bind with me. Grace, 8 years together. I was just your stepping stone. Since you're so ruthless, don't blame me.
What is going on? Get him out of here!
What a trash hospital! I'm filing a complaint. I'll expose all of you!
Ethan, you're useless! Why didn't you help me just now?
Ethan, you've only been here a few days. How could you get into such a huge fight with a patient? Easton is a top hospital in this country. So many people would kill to get a spot here. If you don't want to work here, pack your bags and leave.
I didn't even start that conflict. Grace was the one who provoked the patient, and she used me as a human shield.
Ethan! Are you out of your mind saying that?
If I wasn't out of my mind, I wouldn't have loved you for 8 years, completely oblivious to the fact that you were cheating on me.
What are you talking about?
Grace, let's break up.
Break up? Don't regret it. Don't forget who was begging on their knees to be with me.
You're the one who will regret this. Grace, when you realize that the entire Wellspring Group is owned by my family, and you merely for a permanent position couldn't wait to climb into Victor Walsh's bed, I wonder what your face will look like.
Ethan Linden, how dare you? Disrespecting your superior, escalating patient conflicts. Starting today, you are on night shifts for a month. Furthermore, write a 5,000-word self-reflection. First thing tomorrow, bring it to my office. Or else, pack your bags and get out.
I always wondered why Grace was always in your office. Turns out, you two were hooking up. Night shifts? Self-reflection? Not interested. If you have the guts, get the dean to fire me.
You! He actually left?
Ethan is throwing it all away. He's burning all his bridges. 8 years of medical school. What's he gonna do now?
Keep your voice down. Chief Walsh is right there. He's usually never like this. Did he lose his mind today? I can't believe he went off like that.
Ethan Linden, you just wait. I'll make sure you won't last another day at Eastern Medical Center.
In a few years, Aunt Olivia will fall ill. I will be framed. Wellspring Group will be taken away. Since I know this in advance, I will never let it happen. What is this?
Detected nearby. Patient with acute ligament sprain. Rewarding host a starter pack. Master bone setting skill. Issuing beginner mission. Relieve the patient's pain. Mission tip. Bone setting is the foundation of medicine and essential for a legendary doctor. By using this skill to successfully relieve the pain of 10 patients, you can unlock the next advanced skill set.
The system's master skill. This familiar feeling, whether it's bone alignment or the exact amount of pressure, it feels like I've already practiced it 1,000,000 times.
Just my luck. I haven't even delivered the samples yet, and I sprained my ankle. What am I gonna do about this month's quota?
Are you hurt? Let me help you over and take a look.
Are you a doctor at Easton? He's really handsome. Huh? Why is there no name tag?
Just relax. It might be a little sore.
Okay.
Try it.
It really doesn't hurt anymore. Thank you.
Mission progress. 1/10.
You're amazing. Thank you. I didn't even ask him what his name is, but that's okay. Since he's a doctor at Easton, I can definitely find him.
Hello, young master.
Silly boy. I just heard someone bullied you, so I rushed right over. Who hit you? Tell Aunt Olivia. I'll make them pay for this.
Chairwoman Linden, all these years, for Ethan, you ignored the board's opposition and did so much to harm the company's interests. Don't blame me. It's the board's decision.
Aunt Olivia.
You're a grown man now, still crying like a baby. Aren't you afraid people will laugh at you?
Aunt Olivia. No matter the cost this time, I won't let anything happen to you.
Well, well. No wonder you couldn't wait to dump me. You hooked a sugar mommy. Dressed all fancy, but clearly she's old. An old lady keeping a boy toy. Shameless.
Such a filthy mouth. Did you just get out of Victor Walsh's bed and forget to rinse?
Ethan! What the hell are you talking about? Chief Walsh and I are completely innocent.
What's going on between you two? You know perfectly well.
I did want to use Chief Walsh to get the permanent spot, but how did Ethan find out? Ethan! Don't get too cocky. Your termination letter is already on its way. You crossed Chief Walsh. I'd like to see which hospital would dare to hire you. Oh, is that so?
Let's wait and see.
Ethan, what's going on here? If I'm not mistaken, isn't she the girlfriend of 8 years you said you were going to bring home for the new year?
I was blind back then. Aunt Olivia, I've come to my senses. Breaking up with her is for the best.
Our Ethan is so outstanding. You deserve better. You only chose to study medicine for her. If you don't want to be a doctor, I can help you start your own business. Or you can return to Wellspring and slowly learn management. In the future, I
want to be a doctor, Aunt Olivia. I have a favor to ask you.
Between us, you never have to ask.
I want to buy St. Easton Medical Center.
Young Linden, from now on, our Easton will be a property of the Wellspring Group. If you have any instructions, please tell me.
Dean, I study medicine to save lives. In the hospital. Don't reveal my identity. No special treatment.
Young Linden, you're so young yet so ambitious. It's truly admirable.
As for my internship, I'll continue it.
No problem, no problem. It's just that your medical license is still processing. Seeing patients alone might be.
How about this? I'll arrange for Chief Johnson from the ER to mentor him on paper. Does that work for you?
Sounds good. The ER has many patients. Perfect for gaining experience fast. Great.
Ethan, our hospital recruited 20 interns this time. Only 2 will stay on. The rest will be sent to local clinics. Dean Warren called me personally to mentor you. Tell me the truth. Are you related to the Dean?
Chief Johnson, I'm not.
Good. Connections mean nothing to me. Outpatient is the front line. Patients put their lives in your hands. Skills and responsibility are always a doctor's top priority. If your attitude isn't right, leave while you still can. Just leave.
Chief Johnson, don't worry. I'm here to learn real skills.
In a bit. When the numbers are called and patients come in, watch closely. Learn carefully. Assist me first. Record medical histories and observe vital signs. Without my permission, do not treat them on your own.
Okay.
Wasn't he fired? Why is he still at the outpatient clinic?
That old fool, Adam Johnson. Does he really want to go against me? Taking in such a loser.
I think he's just at his wit's end. Knowing he can't survive on his own, he wants to rely on Chief Johnson to get a recommendation.
Adam Johnson is about to retire. What power could he have? He thinks finding a backer will let him stay at the hospital.
Chief Walsh, Ethan bullied me. We can't just let this slide.
Don't worry. Once I catch them making a mistake, I'll make sure both of them are completely ruined.
Look here, for this kind of open wound, you must clean it thoroughly, but you have to avoid damaging the internal blood vessels and nerves.
The wound is contaminated, needs debridement and suturing, but this doesn't fit the bone-setting task criteria. Still 9 cases short.
Doctor! Doctor, help me! My hand is broken!
Detected nearby. Patient fits task criteria. Distal radius fracture with severe displacement. Host, please treat promptly.
Doctor! I fell working at the site. If this hand is ruined, I won't be able to work. My wife's medicine, my kids' school fees. It all depends on what I send home. What am I gonna do?
Comminuted distal radius fracture. Severe displacement, but no major nerves or vessels damaged. With precise reduction and proper fixation, within a month, resuming light labor should be no problem. Sir, don't worry. I'll definitely fix you up.
Doctor! Please! You gotta help me! My whole family depends on these hands!
Don't worry.
Stop! Ethan, you're just an unlicensed intern. Who said you could treat him? And you, Chief Johnson. Is this how you mentor your students?
Chief Walsh, that's a bit harsh, don't you think? Ethan was just performing a physical exam on the patient. He's assessing the condition. This is completely in line with internship protocols.
Physical exam? I heard what he just promised to the patient. I heard it clearly from outside. Without any imaging evidence or a comprehensive assessment, he made big claims. Tell me, where is the medical rigor in that?
Ethan, how dare you dump me? Serves you right. Let's see what you do now. According to protocol, treating a fracture means ruling out underlying conditions first. We need blood tests, x-rays, and a 3D CT scan to locate the fracture before diagnosing it. Not just feeling around blindly and guessing. Ethan, you're hurting the patient.
Doctor, all that stuff you just said, how much will it cost? I only have a few $100s on me.
Why worry about money at a time like this? For your condition, I suggest scheduling surgery immediately. You'll need to stay for 2 weeks and undergo rehab. Prepare $50,000 for now.
Look at this. This is a rigorous clinical approach. Grace may be young, but her skills are solid, and she is very thorough.
Where would I get that kind of money? Forget it. I'm not treating my hand.
Grace, your plan sounds impressive and perfectly standard, but honestly, to me, it's just a load of crap.
Say that again, you brat!
I said, her plan is a load of crap. Did you ever bother to ask about his family situation? Did you even notice the calluses on his hands or the clothes he's wearing? For an older guy who still does hard labor just to make a living, you instantly demand expensive surgery and a hospital stay? Yes, your procedure is perfectly standard, but are you really, truly healing the sick?
I don't need all that fancy stuff. I just want my hand fixed so I can get back to work. If it's going to cost me tens of thousands of dollars, then forget it. I'll just go home and tie some sticks to it. I can't let one hand drag down my whole family.
Some of our doctors have been in AC rooms so long, they've probably forgotten what the word compassion even means.
You! Ethan, Adam Johnson, you are really letting an intern mess around.
Ethan doesn't even have a license. If this turns into malpractice, can you take the responsibility?
If fear of responsibility makes you forget why you're here, then why even be a doctor?
Young doctor, I believe you. Just do it. Anyway, my hand ain't worth much.
Brother, your injury. I can do a manual reduction, put the bones back in place, and then put a cast on it. It will cost about around $150, but when I do the reduction, it might hurt a little. You have to bear with it.
I'll endure it. I can endure it. $150? $150. Okay, let's do this.
Ethan, if you dare treat him today, I'll report your violation of protocol to the Dean in detail.
Go ahead. Go do it right now. Ethan, treat him your way. If anything goes wrong, I'll take the blame with you.
I am recording you right now.
Here we go. Relax. Buddy,
Oh no, something's wrong.
Ethan, you hurt the patient.
Here, take a look. Your protocol violation. I've sent it all to the Dean. Adam Johnson, Ethan, just wait for the severe consequences.
What's going on here? Chief Walsh, didn't you say someone here committed a serious protocol violation?
Dean, this intern, Ethan, enabled by Chief Johnson, performed unauthorized and dangerous manual therapy. It left the patient in an unknown condition. This is highly unacceptable.
What kind of act is Mr. Linden putting on? Dr. Linden. Ethan, is what Chief Walsh said true?
Yes.
This kid. Why is he talking nonsense in front of the dean? Dean, I authorized and supported Ethan's procedure. It's mainly my fault. If there's a punishment, then punish me. I'm already old. It doesn't matter. Please don't ruin a young man's future.
Who said I committed malpractice? Sir, wake up, sir. Wake up! I said resetting it would hurt a bit. He just passed out from the pain.
It really doesn't hurt much anymore. I can move it. I can really move it.
Even if nothing went wrong, it doesn't change the fact that you violated protocol. Dean, this must be severely punished to set an example.
Exactly. We can't tolerate such misconduct.
Ethan, the outcome is good, but next time this happens, you need to be more careful. Since it's your first offense, I'll let it slide.
Just this once.
Yes, Dean. I understand.
Dean, how can you just let them off?
Are you the dean or am I?
My savior.
Sir, please get up. It's my duty as a doctor.
You are my savior. By healing my arm, you saved my entire family.
Patient's sincere gratitude detected. System reminds host. Congratulations, host. You've received the mystery chest. Chest stored in the system vault. System reminds host. System reminds host. System reminds host. It can be opened anytime. Mystery chest.
Could it be? As long as I get a patient's sincere gratitude, I'll receive extra rewards. System, open the chest.
System reminds host. Congratulations, host. You have acquired a piece of future business intelligence. Host, please note. Tomorrow at 10 a.m., signing the Series A investment agreement, Olivia Linden will be at with Blue Core Technologies is risky. Wellspring Group headquarters. Their core technology has major flaws. To sign the Series A investment agreement with Blue Core Technologies, tomorrow at 10 a.m., the core technology of Blue Core Technologies. Host, please note. Olivia Linden will be at Wellspring Group headquarters to sign the Series A investment agreement, has major flaws, with Blue Core Technologies. Their core technology has major flaws. Within 6 months, they will enter bankruptcy liquidation. This investment failure will cause Olivia Linden to face a crisis of trust from the board. Host, please note. A better recommendation. A better recommendation is Nexus AI Technologies. Nexus AI Technologies. Also in the AI sector, its current valuation is low. Also in the AI sector. Recommend a $60 million investment for a 15% stake. Its current valuation is low. Recommend a $60 million investment for a 15% stake.
Investment advice too? This time, no matter what, I need to stop Aunt Olivia from making a mistake. Looks like I need to go home tonight.
Chief Walsh, we're done here. Hurry back to your clinic. Your patients are waiting.
What are you looking at? Go see a doctor if you are sick. If not, just leave. Don't block the doorway.
Fine, we won't. Last time my relative saw you for a frozen shoulder, you ran a ton of tests. It cost a fortune, and it didn't even help.
So expensive and totally useless. We're here for the young miracle doctor. Nobody wants to see you.
Fine.
Yeah. Evil. So ungrateful.
Ethan! Don't be too happy yet. I won't let you get away with this.
Ethan is so tough.
We are all interns. Why is he so outstanding?
Since everything's fine here, I'll head out. If you have any issues, come find me anytime.
That's weird. What's wrong with the dean today? Did he take the wrong meds? Being so nice.
And me. Doctor, over here. When is it my turn?
Looks like I can max out my tasks today. I'm exhausted. Med library system. Check task progress.
Orthopedic manipulation skill. Congratulations, host. Orthopedic manipulation task progress. 12 out of 10 on overcompleting the novice task. Task progress. 12 out of 10. Distributing rewards now. Congratulations, host. You have overcompleted the novice task. Distributing rewards now. Congratulations, host. You have obtained. Congratulations, host. Master suturing skill set. You have obtained Master suturing skill set. This skill set covers Western suturing techniques and microvascular and nerve anastomosis. This skill set covers Western suturing techniques, including general suturing, intradermal cosmetic suturing, and microvascular and nerve anastomosis. Traditional acupuncture, classic filiform needle, microblade therapy, electroacupuncture. 2. Traditional acupuncture, microblade therapy, and acupoint injection. 2. Traditional acupuncture, including classic filiform needle, electroacupuncture, microblade therapy, and acupoint injection. 3. Special applications, including battlefield emergency suturing, plastic surgery cosmetic suturing, and advanced techniques.
It even covers cosmetic suturing. This is so comprehensive. With this, if I encounter patients needing delicate suturing, or even if Aunt Olivia needs surgery, with this kind of master skill at my disposal, maybe I can actually help out.
New task released. For 20 patients, complete suturing or acupuncture treatments. Once completed, unlock the next advanced skill set.
20! Looks like I'm heading back to the hospital tomorrow to keep grinding. Aunt Olivia, you're back?
Ethan, when did you get back? Are you hungry? There are leftovers in the fridge.
I'm not hungry. Aunt Olivia. Why do I feel like you're not looking so well?
Just haven't been sleeping well lately.
Aunt Olivia. At the hospital today, I learned a new massage technique. Let me try it on you.
Oh, looks like our Ethan has really grown up. You actually care about your aunt now. Go ahead.
Aunt Olivia, is something on your mind?
Just the usual company stuff. New trends in the pharma industry keep popping up one after another. Wellspring has been rooted in traditional medicine for 30 years. It's hard to turn a big ship around. Those old guys on the board are pressuring me every single day.
No wonder Aunt Olivia is so anxious to invest in tech companies. It's my fault. All these years I only cared about Grace. I refused to help at the company. Otherwise, Aunt Olivia, I can help you.
You? You?
Aunt Olivia, are you planning to invest in Blue Core Technologies?
Ethan, that's a company secret. How did you know?
Aunt Olivia, absolutely do not invest. I have my own sources. Blue Core's core algorithm has a fatal flaw. They'll go bankrupt within 6 months. Getting in now means you're just holding the bag. There's a new company in the same space called Nexus AI Technologies. Their valuation is low right now. $60 million gets you 15%. The 3-year return is over 20 times.
Okay, I'll listen to you. I'll invest in Nexus AI. But I have one condition.
What condition?
Ethan, it's time you learned how to manage a company. Under Wellspring Group, there's a medical device company that works closely with the hospital you bought. I'm planning to hand it over to you for practice.
Aunt Olivia, I still need to work at the hospital.
It won't affect that. Being a dean also requires learning management. Ethan, I can't protect you forever.
Okay.
Deal.
Hello. Dr. Linden, good morning. Great job yesterday. Go on, go on.
Dr. Linden, this is for you. You're so handsome.
Chief Johnson, what's up with everyone today?
Haven't checked your phone today?
Haven't had the time.
See for yourself.
Awesome! That takes 30 years of practice at the very least! Which hospital booking an appointment now? Who filmed this?
The patient secretly filmed it. First thing this morning, Dr. Joe from Orthopedics came all the way over to ask me if you want a transfer. Your skill in bone setting is sharper than the ortho chief. Do you have any interest? Think about it.
No thanks. I like the ER. If I go to ortho, where would I get my suturing tasks?
That's true. The ER sees it all. Lots of chances to practice.
You can't even handle a simple task. You're completely useless.
What's going on?
You can't even handle a simple task. What are you even good for?
Why is Chief Walsh freaking out?
Looks like a medical rep brought the wrong supplies.
I asked for sutures. And you bring me cosmetic threads? Come see for yourself. This wound is so long and so deep. You want me to do plastic surgery on her leg?
Chief Hughes, I'm sorry. I thought today was a regular delivery. I didn't know.
When your company delivers supplies, don't you check with the clinic and give us a heads up?
I am so sorry. I'll go back and swap them out now.
Swap them out? The patient has already been waiting for 20 minutes, and you want to swap them out? If you can do your job, do it. If you can't, get the hell out.
Doctor, will my daughter's leg leave a scar?
Is a scar really my concern right now? Without the right sutures, you're asking me. Who am I supposed to ask?
It's her. You're hurt. Let me help you over and take a look. Wellspring Medical Sales Division, Ivy James. Isn't this the company Aunt Olivia mentioned yesterday, the one she wants me to practice managing? She's my employee. She's my employee.
What's going on?
That girl is from Wellspring Medical, a medical rep. She brought hospital supplies for Chief Walsh to try out. Grace called for sutures, but didn't specify what kind. So she brought cosmetic ones.
Cosmetic sutures? Aren't they thinner and pricier? Why is Chief Walsh so mad?
The wound is deep and long. Cosmetic sutures are too thin. Sewing up a high-tension wound like this, they could easily snap. Chief Walsh is afraid of complications. But still, there's no need to yell at the girl until she cries.
For a long wound on the lower limb like this, the best option is to use 3/0 or 4/0 nylon sutures for interrupted suturing, aligning it properly. Then combine it with intradermal cosmetic suturing for tension reduction. It won't snap, and the scar will be minimal. It's a pity, though. Her legs are so fair and straight. If they use thick sutures, it'll leave needle marks. From now on, she'll only be able to wear pants.
I don't want a scar. Doctor, please think of a way. I'm a dancer. I've been dancing for 10 years. I have a stage performance coming up. If I get a scar on my leg, all my hard work over the past 10 years will be wasted. I'm begging you, doctor.
Cosmetic suturing. If I were to sew it up...
Nearby patient detected meeting treatment criteria. Host, please complete 1 med library system alerts. Host, high difficulty cosmetic suturing ISAP. Nearby patient meeting treatment criteria detected. Host, please complete task progress. 1 high difficulty cosmetic suturing ISAP. 0 out of 20. Task progress. 0 out of 20.
What's the point of crying? Right now, your biggest worry should be the healing process. Aesthetics are no longer my concern.
No, I don't want a scar.
Who says we can't use cosmetic sutures?
It's him, Ethan Linden.
You again? Suturing is a surgical skill. Don't think just because you're good at bone setting that you can come in here and show off. Get out of here!
So, his name is Ethan Linden.
A long, oblique laceration on the lower limb, deep into the dermis. Though it hasn't damaged the tendons or major blood vessels and nerves, if we use regular silk sutures, it'll leave a noticeable scar. For this kind of wound, I can use cosmetic sutures to perform a tension-reduced cosmetic closure. This way, the scar will be very thin, and in 6 months, it'll be practically invisible.
Really, doctor? You can sew it? Please, you have to help me. I'm begging you.
Sincere gratitude from the patient detected. Congratulations, host. You have received a mystery chest. The chest is stored in the system vault. It can be opened anytime.
A gold drop already? I haven't even started yet.
You're going to use cosmetic sutures to do an intradermal closure for her? Ethan, look closely. This is the trauma ER, not plastic surgery. You're just an intern. You haven't even done cosmetic suturing before. How dare you bite off more than you can chew?
Ethan, don't think helping an old man set a bone means you can treat anything. Cosmetic suturing requires specialized training. Have you even taken the class?
It will hurt a bit, but I'll try to keep it flat. Later on, the scar will fade into a white line. You won't see it unless you look closely. Are you willing to let me try?
Yes, I am. Mom, I want him to do it.
But he's so young. He's just an intern.
Mom, I can't have a scar. I trust him.
Ethan, you insist on interfering with my patient, huh? If you use cosmetic sutures, and it bursts, or gets infected, you take all the blame.
Fine.
Could it be he's doing this to help me?
Ready?
Go ahead, suture. Rule violation. I've got all the proof. Ethan, you got lucky last time. Let's see you escape this.
This suturing technique, it's just 2 millimeters from the wound edge.
What's wrong? Is there a problem?
Look, he placed the first stitch where the tension is lowest. The entry angle is almost vertical. This minimizes epidermal damage to the fullest. The exit point is perfectly aligned with the entry point, not off by a fraction. This is textbook suturing.
No, it's beyond textbook. Look, the spacing of each stitch and needle depth are completely identical. How many stitches does it take to achieve this kind of precision? He's doing a continuous intradermal closure. He's using cosmetic sutures, but applying a plastic surgery tension-reducing technique.
What does that mean? We're all interns.
Has Ethan's technique really advanced to a level that I can't even understand?
Standard suturing just brings the edges together. This lets the wound heal without any tension. Once it heals, the scar will look natural, almost invisible.
Impossible. This is impossible. He's just a fresh intern. How does he know this suturing technique?
All done. Don't get it wet for 3 days. Come back in 7 to 10 days to get the stitches out.
This is my wound?
This scar, will it really fade into a white line?
Take good care of it, and it won't be a problem.
Thank you, doctor. What is your name?
Ethan Linden.
Dr. Linden. I'll remember you. When I come back to get the stitches out, can I see you?
Sure. Register at the ER. I'll be there.
Detected patient's heartfelt gratitude. Congratulations, host. Received mystery chest 1. Stored in system vault. Can be opened anytime.
Another chest. Just one procedure, and I got 2 gratitude chests. What an amazing patient. Let me see. Move, I can't see.
He actually finished.
What's everyone doing here?
Dean, you're just in time. It's this intern, Ethan Linden. He took over my clinic and did cosmetic suturing on a patient. This is a severe violation.
Dean, everyone here saw it clearly. Ethan violated protocol. You must punish him.
Why is it this troublemaker again? Well, is the patient's wound taken care of?
It's taken care of.
Is the patient satisfied?
Satisfied. Very satisfied.
Dr. Linden's skills are amazing. Thank you, Dean. Thank the hospital for training such a great doctor. Some other day, I'll definitely send a thank you banner.
Good. You see? The patient is satisfied. The doctor is responsible. So what's the problem?
Dean, this isn't about whether the patient is satisfied or not. This is a severe violation. He doesn't have a license. What if...
Chief Walsh, Dr. Linden is an intern under Chief Johnson. Chief Johnson was here the whole time, so how is that taking over? Right, Chief Johnson?
Right. I supervised and guided him the whole time. Ethan's operation was completely within protocol.
See? No problem at all. All right then, that's it. Everyone back to work.
He's so handsome.
Why are you all just standing there? Don't you have work to do? Clear out, go!
Glad I made it in time. The dean is really protecting him. Could this kid be the dean's illegitimate son?
Two chests.
The host currently has mystery chest ×2. Open them?
Open!
Congratulations, host. You obtained future business intel ×2. Intel 1. Wellspring Medical's currently stocked osteo-secure locking plate system has a hidden defect. Within 3 months, there will be 3 reports of clinical fractures, severely impacting the company's image. Intel 2. On the 15th of next month, the State Medical Association will hold the annual Trauma and Reconstruction Academic Conference. Concurrently, there will be a secret statewide orthopedic consumables centralized procurement pilot trial. If Wellspring Medical can complete product iteration registration before the conference, it has a chance to win bids for 3 categories, with an estimated annual sales increase of $320 million. $320 million.
These defective devices must be recalled immediately. Reputation can be rebuilt, but lives can't wait. Hello, Assistant Lewis. It's me. That batch of Wellspring Medical's osteo-secure plates. Halt all shipments, and recall all the ones already sent out.
Mr. Linden, this batch is worth nearly $10 million, if we recall them now.
Recall them all. Clinical feedback shows there's a hidden defect. Register all recalled devices, seal them up, and wait for a quality inspection review.
Understood. I'll do it right away.
Doctor, are you the doctor from the internet who's really good at suturing? Can you stitch this up?
Doctor, look at me first. This is my daughter's favorite Peppa Pig. You have to stitch it up perfectly. My daughter is only 3, and she loves Peppa. If you sew it into a pink hairdryer, she won't accept me as her dad anymore. And mine!
Don't rush. Line up, one at a time.
Wow!
Detected that the host has completed today 9 cosmetic suturings, 16 standard debridement suturings. Task progress, 25 out of 20.
Finally done. I wonder what I'll unlock this time.
Distributing advanced rewards now. Congratulations, host. You obtained. Congratulations, host. You have obtained Master Hemostasis skill set. This skill set includes 1. Manual hemostasis, digital pressure hemostasis, pressure dressing hemostasis, tourniquet hemostasis. 2. Instrumental hemostasis, hemostat clamping, electrocautery hemostasis, ultrasonic scalpel hemostasis, argon plasma coagulation. 3. Advanced applications, major blood vessel injury repair, amputation hemostasis, intraoperative craniotomy hemostasis, cardiac surgery hemostasis, hemostasis.
This is the most crucial skill on the operating table. So many surgical accidents, when patients don't make it, aren't due to bad surgeons, but unstoppable bleeding. With this, if Aunt Olivia ever needs a craniotomy, I'll be much more confident.
Aunt Olivia, what brings you here?
Just passing by. Thought I'd come see you. I heard you recalled a batch of medical equipment.
How did you find out so fast? Osteosecure locking plate system. I suspect there are quality issues. I've suspended shipping, and everything dispatched has been recalled.
What's the loss?
Nearly $10 million. Plus recall storage and quality checks. It should be around $40 million, Aunt Olivia. If that batch really had quality issues, it could cost people their lives. Money can be made back. Lives can't be replaced.
You did the right thing.
Aunt Olivia.
A hospital is a place to save lives, not a business. Medical equipment leaves no room for error. Lives are at stake. As for money, we can afford to lose some. As for the board, I'll find a way to handle them.
The board is pressuring Aunt Olivia. That's why she came to see me.
David Carter, senior partner, has never been satisfied with me taking over the company. This time, the medical equipment recall was reported to headquarters by him.
David Carter. Aunt Olivia, I'll go to the medical expo with you.
You?
Don't worry. I'll make the board have nothing to say. The system warned me early on about this equipment issue. As long as I prepare the alternative's clinical data and the quality reports and present it at the expo, even the board of directors won't have anything to say.
My Ethan has really grown up.
Aunt Olivia, I'm sorry for making you worry all these years.
What are you talking about? We're family.
Don't worry. From now on, it's my turn to protect you.
You too. Ethan, I can't believe you're in the office, hooking up with this old woman. I'm going to send these pictures to the work group right now, so everyone can see your true colors.
Grace, what are you talking about?
Dr. Linden doesn't seem like that kind of person. He's always so patient with his patients and polite to everyone.
What do you know? Ethan, he's just a scumbag. I was wondering why he broke up with me. He found a sugar mommy. No wonder he got that position. Turns out he's with this old woman.
That actually makes sense.
But Dr. Linden.
You dare hit me.
Since you and Ethan used to be a couple, I let things slide. I didn't expect you to push your luck. Did you really think I didn't know what you did?
You old hag. I'll make you pay.
Don't you dare touch her.
Ethan, let me go! You pathetic leech. I will ruin your life. I'm calling the cops now. Just you wait. I'm calling the cops right now. I'll put you both in jail.
What's all this noise? What's going on here?
Dean, you're just in time. I want to report Ethan and this old hag for having an affair in the office. I caught them red-handed. Ethan.
Dean, we have both witnesses and evidence. I suggest we fire Ethan immediately and call the police. Keeping his kind in the hospital is a disgrace to our profession.
Yes! Call the police! I'm calling them right now.
You? You're not worthy. Victor Walsh. Grace White, right? Starting today, you're both fired.
Fire me? Just you? Who do you think you are?
Stop pretending! You think I'm scared just because you hit someone? I'll expose you right now, and let everyone see the true colors of you two scumbags. Just you wait. I'm going to ruin you both.
Let me tell you. I'm the Associate Chief Physician of St. Easton Medical Center. Fire me? Like you have the right.
Chairman Linden. That's right. This is the chairwoman of Linden Healthcare Group and St. Easton Medical Center's largest shareholder.
Linden Healthcare Group? You mean the one that just bought our hospital? Linden Healthcare Group? Oh my God. Doesn't that make her the top boss here?
Impossible. How is this possible?
Linden Healthcare Group?
Dean Warren. Do my words count now?
Of course they do. Victor Walsh, Grace White, effective today, you are both fired. Your HR paperwork will be ready by tomorrow. Now, leave the hospital immediately.
Impossible. I've worked here for 15 years. Dean!
It's over. It's all over. I worked so hard for this full-time position. Ethan, I was wrong. For the sake of our 8 years together, put in a good word for me. You can't do this to me.
When you threw me under the bus, why didn't you remember I was your boyfriend?
Security.
Dean! Let me go. I can walk by myself.
Ethan! You can't do this to me.
Don't get too smug. I won't let you get away with this. Ethan, make a clean break. A woman like her doesn't deserve you.
Don't worry, Aunt Olivia. I don't have any feelings left for her.
That's good. Get ready. Come with me to the medical expo tomorrow.
Okay. Does it still hurt?
The woman Ethan's using, that old lady, she's actually Linden Group's chairwoman.
I can't just let this go.
But even if we can't, what can we do? She's a big shot.
So what if she's a big shot? Even if she's a tiger, I'll pull a few of her teeth out.
What do you mean?
Tomorrow, there's a state medical expo, and I happen to hear at the hospital a little secret about the Linden Group.
Hey.
Hello? Mr. Carter, it's me, Victor.
Mr. Carter, the turnout today is incredible.
Of course it is. Today, every medical firm in the state is here. See those people up ahead? The major medical companies spent a fortune to invite those medical titans. Every single one is an expert in their field. This medical expo might seem to be about products, but in reality, it is a contest of who brought the biggest names. Wellspring Medical recalled a huge batch of equipment. They're a total mess internally right now. If we can make them embarrass themselves today, Olivia Linden and her trust with the board will completely collapse.
And then...
Don't worry, Mr. Carter. The issue with that equipment, I've already had someone leak the news to the media. Once things blow up today...
The Linden Group is long overdue for a new boss.
Someone's targeting Wellspring Medical. I'm just a lowly medical rep. What should I do? Didn't the company say they'd send a new person in charge today? Where are they? Dr. Linden! Why is Dr. Linden here? Is he here for the medical expo too?
Ethan.
What is he doing here? And dressed like that?
So that is Ethan Linden, which means he is Olivia, Linden's useless nephew.
Oh, Mr. Carter. You're here early.
Chairwoman Linden, such a grand occasion. You came in person.
Of course. Wellspring Medical has a new director. It's his first appearance today. As the chairwoman, I should at least be here to show my support.
I hope after this expo, you can still smile so confidently.
Chief Walsh, an occasion like this today, why is that poor boy Ethan here? Dressed like this? He seems like a different person.
What are you panicking for? He's here at the perfect time. Right in front of all these people. Let's expose their dirty laundry.
Today, I'll let them know. What happens when you cross David Carter?
Distinguished guests, medical experts, and seniors. The Provincial Orthopedic Consumables Centralized Procurement Pilot Medical Expo begins now. This expo upholds the principles of fairness, justice, and openness. Medical companies will present their products in the order drawn. First, let's welcome.
Hold on. Wait!
Mr. Carter, do you have something to say?
Everyone here is a colleague in the medical field, saving lives with high medical ethics. So before the medical exhibition begins, I have a few words that I must say in front of everyone clearly. After all, in our medical field, we cannot have any black sheep.
What's he doing?
No idea, but judging from his look, he's up to no good.
On Olivia. Don't worry. I'm here.
Chief Walsh, come on up.
Distinguished guests, fellow colleagues, I am St. Easton Medical Center's former Deputy Chief Physician, Victor Walsh. Today, I am publicly exposing Wellspring Medical. Everyone might not know this yet, but Wellspring Medical's OsteoSecure locking plate system has severe quality issues. When I was at St. Easton, I saw it with my own eyes. These devices will actually break during clinical use.
What? The medical devices break? That's basically murder.
If these devices are used on patients, the consequences would be disastrous.
Wellspring Medical must give us an answer today.
Isn't Wellspring Medical an established brand? How could this happen?
I've heard about this too. Looks like there really is an issue.
I propose we immediately revoke Wellspring Medical's bidding qualification. A company like this doesn't deserve to join the state procurement.
Yeah, disqualify them.
A company like this should be blacklisted immediately.
Disqualify them.
Ethan, let's see how you survive this.
So this is the old dog who's been going against Aunt Olivia. Humph. Watch how I deal with you. Who says Wellspring Medical had an incident?
No accidents. Chief Walsh exposed it himself. How could it be fake?
Wellspring Medical has been in business for 30 years, always operating with integrity. When the OsteoSecure plate system showed safety hazards, we immediately started the recall process. Here are the recall batches and quality reports. All the data is completely transparent.
Who knows if your report is fake?
Not only that, all losses caused by this recall will be borne by Wellspring Medical. For all hospitals that ordered our devices this time, we will provide for free replacement products to ensure clinical use is not affected.
I can vouch for that. Our hospital bought their plates last month. Wellspring Medical proactively recalled them. Replacements arrived within a day. No surgeries were delayed.
Right. Same with our hospital. Honestly, suppliers with such integrity are rare.
Mr. Carter, the black sheep you mentioned, does it mean a company that exposes its own flaws and fixes its own mistakes? Or does it mean those with malicious intent who try to drag others down?
Daniel Clark, for a man your age, treating a business war like kids playing house, aren't you embarrassed?
You...
Even if the equipment is fine, you're still morally corrupt. Ethan, the reason you got into St. Easton is because this old woman paid your way in. They are lovers, playing with patients' lives.
Is that true?
If it is, that's
That's a lie. Dr. Linden's surgeries, I've seen them myself. He relies on his skills, not connections.
Shut up! Who do you think you are? Get out of my way!
Dr. Linden, he protected me again. He's so manly. He's such a great doctor, and he's helped me so many times. Oh my God. If he asks me out, should I say yes right away, or play hard to get first? Saying yes right away, would that make me look too easy? But if I play hard to get, what if he thinks I'm not interested?
Ethan, this is a medical expo, not a place for you to act wildly. You're just a poor intern. What right do you have to boss around here?
Who says I have no right?
What do you mean?
My apologies. I forgot to introduce myself. I am Wellspring Medical's new director. Today, I represent Wellspring Medical at this medical expo.
The new head of Wellspring Medical, Dr. Linden. The Linden of Linden Healthcare Group. He is my boss.
Ethan, cut the act. You clearly latched onto this old woman to get where you are today. What new head? She just bought that title for you.
Exactly. I did latch onto a rich woman. But she is my own aunt. I latched onto my aunt. Got a problem with that?
Aunt?
Ethan is my nephew, the heir to Linden Healthcare Group, let alone a small company like Wellspring Medical. In the future, the entire Linden Healthcare Group will be his. He's the heir to Linden Healthcare Group?
Unbelievable! Ethan! You are the heir to Linden Healthcare Group! Why didn't you say so? If you had told me earlier, how could I have tell you earlier? So you could use me as a stepping stone.
I can't believe that for a permanent spot at the hospital, I gave up the heir to Linden Healthcare Group.
Linden Healthcare Group? He's actually from Linden.
Everyone, we at Wellspring Medical are not here to argue, but to show everyone our sincerity. This is Wellspring Medical's newly developed microvascular anastomotic device. Microvessels with a diameter of less than 0.3 millimeters can also be sutured. The surgery time will be reduced by 40%, and the post-operative patency rate will exceed 98.7%. 0.3 millimeters.
That's a world-class challenge in the field of microsurgery.
That's impossible. If this data is real, then this technology will be 3 years ahead of the industry.
Mr. Carter, This is the true sincerity of Wellspring Medical. As for your mudslinging tricks, keep them to yourself.
David Carter, at your age, instead of focusing on product research, you resort to these dirty tricks. Have you no shame?
You insolent little girl!
Mr. Carter, are you okay? Mr. Carter, what's wrong? Mr. Carter!
Not good. Heart attack.
Rapid heart rate. No blood pressure. Wait. This isn't a normal heart attack. It's a ruptured aortic aneurysm. He's already hemorrhaging. A ruptured aortic aneurysm. We must open his chest to stop the bleeding. Otherwise, he'll be dead in 5 minutes.
Too late. Even to the closest hospital. With this bleeding, he won't survive the trip.
Right next door. There's a fully equipped OR. Everything is ready to use.
We have an OR, but what's the point? An emergency thoracotomy needs a top surgeon. Us old guys are too old. Our hands shake. We can't handle such a delicate surgery. Out of everyone here, who can take this case?
A ruptured aorta.
One wrong move, and he'll die on the table.
No way. Just one word from Aunt Olivia, and he got this mad? He's so weak.
Critical patient detected. Advanced skill practice conditions met. Issuing temporary task. Perfect hemostasis. Task completion reward. Skill upgrade pack.
This works out. If he dies here, Aunt Olivia will definitely be blamed. I'll be the lead surgeon.
You?
Young man, how old are you even? This is a ruptured aorta, not just basic suturing. Young man, don't be impulsive. Now's not the time to show off or play hero.
Everyone here is a top medical expert. You can all supervise and guide me. But right now, I'm the only one with steady hands.
The kid is right. We're getting old. Our hands are shaking. Operating means certain death.
But he's way too young. There's no time. We need to save him. Let him do it. Us old guys will be watching. If anything goes wrong, we'll take the blame.
Aunt Olivia, wait for me.
What's wrong?
Why did he stop? The patient can't wait.
My hemostasis skills, though enhanced by the med library system, for an aortic replacement, a surgery of this magnitude, the incision's position and angle, even a millimeter off could affect the subsequent procedures. I need an assistant for the incision. I need someone to help me make the incision.
Makes sense. An aortic surgery is indeed hard to handle alone. So, who's going?
He can't even make an incision, yet he shamelessly boasts about doing an aortic repair. Ethan, with so little skill, you dare to take the stage? You really don't know your limits.
Chief Walsh is right. Making incisions is a basic surgical skill. Chief Walsh has worked for 15 years, so he must have perfected it by now. Why don't you come up here, Chief Walsh, and help me finish this surgery?
Victor Walsh. He just said he is a deputy chief physician at Easton. Yeah, barely qualified.
Don't waste time. Get up there.
Chief Walsh, this is your chance to shine in front of these top experts. If it works out, we'll make a huge comeback.
Chief Walsh, after you.
Good positioning. Gives a clear view.
The incision angle is good too. Following the muscle grain reduces damage.
The incision spot isn't bad, but a perfect cut makes the rest of the procedure a breeze. If I could just unlock the med library system's master incision technique, I could actually finish this surgery all by myself.
Good spot. Close to the bleeding site. It'll quickly expose the surgical field.
The top experts are all watching. If I can make this look even better, I might just catch their eye and score a new job recommendation. No risk, no reward. I'll take the incision a bit deeper. Let's show them what I can do. Impossible. I barely even touched it.
Blood pressure is dropping. Irregular heartbeat. Massive bleeding.
This is bad. He punctured the aneurysm.
Wait, no, it's not a ruptured aneurysm. Look at the pericardium.
The aneurysm's pressure shifted the pericardium. His cut hit the pericardium.
Now the artery and atrium are bleeding.
With dual source bleeding, he's losing blood too fast. Even a miracle can't save him.
I didn't mean to. I just wanted...
Dad! David, you can't die on me!
Doctor, please, save my dad. We'll pay whatever it takes.
Doctors, I'm begging you. Please, you have to save him.
It's not about the money. His aorta and atrium ruptured simultaneously. The bleeding is too massive. There's no way to stop it.
It's too late. You need to prepare for the worst.
It was him. He killed my dad.
You quack. You murderer. Give me back my husband.
It wasn't me. It wasn't me. It wasn't me. It was him. He told me to come. Ethan told me to come up. It wasn't me. Not me. It's over. I killed a man. My life is ruined.
If he really dies here, we're in huge trouble.
What is he doing?
Ethan, what are you doing? Get your hands out of there. That's a sterile area.
Young man, don't mess around.
This is impossible. The blood.
Blood pressure is stable.
This is impossible.
With that much blood loss, how could he stop the bleeding?
Aorta and atrium both ruptured. The mortality rate for this is 100%.
Blood pressure is stabilizing. It's really stable. Dad is going to live.
The doctor, he saved my husband.
Wait. Look at his hand.
He's stopping the bleeding barehanded.
It's digital compression.
He's using his fingers to compress the atrium and the aortic bleeding points.
Impossible. That's the heart. Given the pressure in the aorta, how could he compress it barehanded? Not only did he compress it, but he did it perfectly. Look, the bleeding points are completely sealed, but the surrounding tissue isn't damaged.
What precise force this requires? A bit harder, and there's permanent heart damage. A bit lighter, and the bleeding won't stop at all.
Such feel, such judgment.
I've been in vascular surgery my whole life, and I've never seen a maneuver like this.
If it weren't for Ethan and David Carter died, my life would be over.
Chief Walsh. I'll handle the hemostatic suturing. Can you use a vascular stapler?
Dr. Linden, the stapler.
Perfect timing.
Ethan Linden, right? This kid. His hands didn't shake at all the entire time.
What a remarkable young man. Truly impressive.
Vitals are stable. This surgery is a success.
Congratulations to the host for completing the perfect hemostasis task. Now issuing advanced rewards. Congratulations, host. You have obtained the Master Incision skill set. This skill set covers 1. Basic incisions, including skin incisions, subcutaneous tissue dissection, fascial incisions, and muscle separation. 2. Fine incisions, including adventitial stripping, nerve fascicle dissection, micro-incisions, and corneal incisions. 3. Advanced applications, including cardiac incisions, aortic incisions, intracranial approaches, and precise tumor resection.
Just what I was wishing for. You're the best, Med Library System. With this incision skill set, Most routine surgeries I can handle on my own.
Thank you. Thank you all.
Aunt Olivia.
Stopping an arterial rupture with his bare hands. I've never seen anything like this in my life.
The vascular stapler from Wellspring Medical they just used. Our hospital will order 1,000 units.
I'll order 500!
His medical skills and this technology are a perfect match.
Our hospital wants them too. 200 units to start.
300.
Our statewide hospital chain will start with 1,000.
Dr. Linden. He's so amazing.
Get up, please.
Dr. Linden, you saved my husband's life. You're the savior of our entire family.
Dr. Linden, thank you. Thank you so much.
Chairman Linden, my husband has been working against you all these years. I know. He was foolish. He was always obsessed with power and profit. But I also know he worked so hard to make money. Just for me and our daughter. But today, I finally realize money is nothing compared to health. Nothing compared to family. From today on, the Carter family in Linden Healthcare Group will be on your side. No more fighting, no more competing. We just hope our family can be safe and sound. Mrs. Carter, it's okay. It's in the past.
Ethan. Why him? Just a broke loser I dumped. Why is everyone kissing up to him? Genius doctor? Young and promising? He just happens to have a rich aunt, that's all. Chief Walsh, why did you hit me? We're in this together. Together.
Who's in this with you? From today on, I, Victor Walsh, have seen the light. Dr. Linden, Mr. Linden, that move you just pulled, the manual hemostasis, it was absolutely incredible. In all my years of practice, I've never seen anything like it. I was wondering, could you please teach me?
Chief Walsh, how could you be so spineless?
Shut up! I don't even know you. Mr. Linden, look, I may be a bit old, but I'm willing to learn. And I have the basics down. Don't worry, if you just take me as your disciple, I'll study really hard. I definitely won't let you down.
I don't take disciples.
No disciples? Then take me as your sidekick. I'm yours in life, and yours in death.
All right, get up. We'll see how you do.
Yes. I'll definitely do my best.
Ethan, I took your advice and went for a full body checkup.
How were the results?
There is indeed something growing in my brain, but luckily it's benign for now. I was hesitant before about whether to get the surgery, but your performance today put my mind at ease. Now, I'm ready for the surgery.
Aunt Olivia, just focus on getting ready for the surgery. As for the company, leave it to me. And this surgery, I'll be the one doing it.
Dr. Linden, brain surgery and general surgery are very different. Even if you're a master in general surgery, but
I believe there has to be a way. As long as I have a lot of patients to treat, I'll definitely be able to find a treatment plan for Aunt Olivia.
Dr. Linden, doing rounds yourself today?
Your new patients are in great hands, so don't worry.
Appreciate it.
Those nurses are usually so stuck up. When I was an associate chief, they wouldn't even look at me. So what if he's handsome? In a hospital, medical skills are what matter. I'm not jealous at all.
Dr. Linden, I feel like you're looking even more handsome today.
Hey!
Dr. Linden, come quick, everyone! Dr. Linden is doing his rounds!
Dr. Linden, you're here. I'm feeling much better lately.
Dr. Linden, thanks to your surgery, I can finally walk again.
Heartfelt gratitude from patients detected. Congratulations, host. You've obtained Mystery Chest 1.
With the business intel from these chests, I can plan ahead for the company.
This kid just knows some basic suturing in the ER. Why do the patients love him so much?
Ah, Mr. Clark. Just lie still. Don't move. I'll do it. Let's keep the blanket on. We don't want you catching a cold. Have some water, Mr. Clark. It's the perfect temperature. I checked it myself. Hard to move, huh? Here, let me feed you.
Victor Walsh! What are you doing here? Victor Walsh. What are you doing here? You were fired from the hospital. How dare you come back? Tell me, what tricks are you playing this time?
Dr. Linden! You're finally back!
What, Dr. Linden? Who are you talking about? Walsh! What kind of game are you playing now? You think acting like this will let you stay at the hospital?
Dr. Linden! Dr. Linden! Please, take a seat. Mr. Carter is recovering well. I was just updating him.
Dr. Linden, thank you for saving my life.
What's going on? Mr. Carter is one of Linden's key shareholders. He just had a high-risk cardiac aneurysm surgery. I heard many experts were completely helpless. How could he?
Dr. Linden, Mr. Carter will be able to get out of bed in a few days. You're a miracle worker.
What did you say? This surgery was performed by Ethan?
You didn't know? On our medical forum, Dr. Linden's surgery is all anyone can talk about. Come. Look. See for yourself.
Wellspring Medical, boss. You're Wellspring Medical's boss?
That's not all. Our Easton is now owned by Dr. Linden.
This just can't be real. Thank God. During his internship, when I mentored him, I didn't try to mess with this kid at all. Otherwise, I'd be a dead man.
Chief Johnson. Steady there.
Patient's heartfelt gratitude detected. Heartfelt gratitude confirmed. Congratulations, host. Mystery box 1 obtained. Purple light.
It's different from before. System, open the box.
Congratulations, host. Special item 1 obtained. Business intel 1 obtained. Special item. Ultrafast intraoperative molecular pathology analyzer. Intraoperative molecular pathology analyzer. During surgery, it can analyze tissue slices in real time. Outputs in under 3 minutes molecular pathology results with 99.7% accuracy.
One of the biggest challenges in surgery is that doctors can only rely on experience to remove diseased tissue. If we don't cut enough, the cancer will likely relapse. If we cut too much, it can cause the organ irreversible structural damage. With current technology, it's completely impossible to test samples during surgery. A full traditional pathology test takes at least half an hour. With the patient on the table, anesthesia time is limited. Doctors just can't afford to wait. So they have to gamble. If they win, the patient recovers. If they lose, it's either a relapse or lifelong disability. But with this device, we can test during the operation and get results in 3 minutes. The precision of surgeries will leap into a new era.
Congratulations, host. Future Business Intel X1 obtained. Intel 1. The United States' top global medical equipment giant, MedTech Global, will next Friday partner with 3 investment banks against the domestic medical device industry to launch a full-scale assault. Their goal is to dominate Solaris's medical market. Their first target is Linden Healthcare Group's 3 core subsidiaries. This is expected to cause Linden Healthcare Group to lose 1/3 of its assets.
What? Linden Healthcare Group is Aunt Olivia's life's work. She's having surgery soon. I can't let her worry at a time like this. There's still a week left. I need to get ready. I must help Linden Healthcare Group survive this assault safely.
Dr. Linden?
Mr. Linden.
Dr. Linden. Dr. Linden, are you all right?
I'm fine. Mr. Carter, Get plenty of rest. You'll be discharged in a few days.
Thank you, Dr. Linden.
Alert! Alert! A major public health emergency detected. All departments, please assemble immediately. Alert! Alert! Major public health emergency detected. All departments assemble immediately.
Ding, severe explosion detected at Westside Chemical Plant. Casualties unknown. Emergency rescue mission issued. Successfully treat 50 patients. Reward for completion. Master microsurgery skill set.
Chemical plant explosion.
Urgent announcement. An explosion occurred at the Westside Chemical Plant. A large number of casualties are en route to a hospital. Expected intake is over 200 patients. All ER and surgical doctors, assemble at the emergency entrance immediately.
200 people. Let's move.
Chairman Clark, make sure to get some rest.
Here they come. Here they come. Everyone, get ready.
Burn and combined trauma. Suspected left arm fracture. Straight to the OR. Prep orthopedics and burns. Ethan, you haven't got your independent practice license. You can't lead a team on your own yet. Go to the ER first. Help treat the minor injuries.
Understood. Follow me.
下一位，下一位。
Dean! There are just too many severe cases. All the ORs are completely full now. There are still 3 patients in desperate need of surgery who can't get a spot right now.
What? At this rate, by the time an OR opens up, these critical patients won't last that long. Why are you out here? What about your 3 patients?
They're all done.
That fast?
3 debridements and sutures.
Should take at least half an hour.
Task progress. 3 out of 50. Still a long way to go. Dean, I have a suggestion.
Go ahead.
We should triage the incoming patients. Send the critically injured straight to the OR. For those who are bleeding but not in critical condition, I can first do basic bleeding control. When an OR opens up, I'll give them further treatments. This way, we can ease the pressure on the ORs and buy more time for the critical patients.
Ethan, I know you're a good doctor, but lives are at stake here. We can't afford any mistakes. How certain are you?
100%. Dean, the ORs are packed. This is the only way to buy more time for those critical patients.
All right, we'll do as Ethan says. Listen up. Send all the critical patients waiting for surgery straight to the ER.
Dear, just hold on a little longer. It'll be our turn soon.
I'm fine. It's just a scratch. Yours is much worse. There's blood everywhere. It's a bloody mess. You go first. Listen to me, dear.
During the explosion, you kept shielding me. I was so worried.
My old bones are still quite tough. Don't you worry, dear. You'll go first later. You'll go first.
Next! Coming.
Coming, nurse. Please see my wife first. Save my wife first. Look at her. She's covered in blood.
No, him first.
Hey, you go first.
Dear, you first.
The wound on your arm is just a flesh wound. I'll stitch it up in a bit. But if you don't get surgery now, no one can save you.
Young doctor, don't scare us like that, okay? This is just a minor flesh wound. What do you mean beyond saving? Hurry up and save my wife. She's covered in blood. It's a bloody mess.
Dr. Linden, should we stop the bleeding for the old lady first?
No. You were just hit by the blast wave. The external wound is small, but your internal organs may already be damaged. It doesn't hurt now because the bleeding hasn't reached a critical point.
Enough. You! Why can't you understand me? Are you even a doctor? I already said I'm completely fine. It's my own body. Don't you think I'd know?
Darling.
Sir!
Dr. Linden, what happened to him?
This is the last case. The patient is showing signs of internal bleeding. Blood pressure is dropping fast. He needs emergency surgery. Hurry, find the nearest available ward. Tell the dean we have a critical patient here who needs an emergency laparotomy. Go, now!
Darling, doctor, please save him. Darling. Darling.
Dr. Linden! Dr. Linden! It's all ready. Within 5 minutes, operating room 3 will be available.
Okay. Chief Johnson, scrub in. Join me in the OR.
Me? Mr. Linden, even though I am a deputy chief physician, but I've been in the ER for a long time. I rarely get OR time. For laparotomies, I'm just average.
How about scalpel?
This he's making the cut just like that?
Suction.
Is this really a technique a fresh graduate should have?
Chief Johnson, I had you come here because my medical license hasn't been issued yet. This surgery needs your supervision.
You asked me here just for this?
Liver rupture. Multiple lacerations on the right lobe. Active bleeding.
Is this liver suturing? This is one of the hardest procedures. Too deep, it bleeds. Too shallow, and you can't stop the bleeding. This technique of yours.
How's the blood pressure?
Blood pressure is stable.
Liver suturing complete. Checking other organs. Spleen is fine. Intestines are fine. All bleeding points controlled. Preparing to close.
Something's wrong. Oh no! BP is dropping.
What? Didn't you just say it was stable?
Heart rate is rising, and BP keeps dropping.
In the abdominal cavity, there's no new bleeding point.
Could it be a hidden bleeder? Spleen? Intestines?
I just saw Dr. Linden explore everything. He checked it all. Nothing.
BP is still dropping. If this keeps up, the patient will go into hemorrhagic shock and multiple organ failure.
We must stabilize the BP. Get him blood!
We're out of plasma. The explosion brought in too many casualties. The blood bank's reserves are all used up. If we request more blood, it'll take at least 20 minutes.
Dr. Linden, I can donate blood too. Let me make amends. Take mine.
That's behind the liver. It's a blind spot. What if you hit the inferior vena cava?
Dr. Linden, did you just reach in there? Dr. Linden, you just stuck it in. What's he doing? That's behind the liver. That area.
It's right against the IVC.
One wrong move.
Doctor, please, you have to save him.
No, too dangerous. I'll go in and take over. It's just, I haven't scrubbed in for years. I wonder if I still got it.
Blood pressure is stable.
What? How did he do that?
How is this possible? I see. I get it.
Dean, what did you realize?
This is manual hemostasis. The bleeding point isn't on the liver's surface. It's on the back.
Instruments can't reach.
We can't even see it. You have to reach in and find the point by feel.
Then apply precise pressure to stop the bleeding.
But with so many organs in the abdomen, dense blood vessels, and a bloody mess in there, how did he find the bleeding point?
That's the terrifying part. You have to know human anatomy like the back of your hand. It also takes countless surgeries to build that experience. If it had been anyone else operating today, I'm afraid.
How old is he? 25? 26?
With medical skills like this, and this kind of judgment, in the Solaris medical field, I'm afraid it won't be long before a shining superstar rises up.
Dr. Linden, how did you find that bleeding point?
Bleeding on the back of the liver is usually caused by a tear in the short hepatic veins. The location is hidden, but near the bleeding point, there's a change in tension from the hematoma. Reach in with your fingers, feel for the highest tension, and you'll find it.
Short hepatic veins. Change in tension.
Wow. Prepare the hemostats and sutures. The bleeding point is found, but it still needs to be treated.
Right away, Dr. Linden.
Congratulations. The patient is finally out of danger.
Congratulations, host. Emergency task completed. Master microsurgery. Skill set rewarded.
Mr. Linden, my savior.
Ma'am.
Please get up first. This is what I should do.
My old man and I have been married for nearly 50 years. Those hard days, we've made it through. If it weren't for him today, I wouldn't be able to live
Ma'am,
on my own.
It's my job.
Dr. Linden, thank you. Thank you for saving him. And saving me.
Ma'am, it's my job. Let the doctor take you to see him in the ICU.
Thank you, Dr. Linden.
Young Linden, you're absolutely incredible.
What's wrong? What is it?
Look at this. The surgery just now, over 30 major hospitals nationwide, watched it live. The community is blowing up. Look, Dean Lewis, Chief Johnson, Professor Lewis, they're all asking who the lead surgeon was. I've already received over a dozen demo surgery invites. They all want to see you perform another one.
Over 30 major hospitals nationwide were watching?
That's right. Our hospital's internal network is linked to the national medical system.
For complex surgeries like this, we usually live stream them for our peers to learn from.
The system said MedTech Global will target Linden Healthcare Group next week. If I can seize this chance, I can save Linden Healthcare Group.
Hurry up! Be careful!
Young Linden, what exactly is going on here? I really don't understand.
Mr. Linden, based on your blueprints, the engineers worked 24/7 for a week. Assembly and testing are finally done. Here's the test report. All parameters are completely normal.
Good work.
Young Linden, what exactly are you doing? What is that machine for?
Dean, I asked you to invite 100 top hospitals nationwide to watch the live surgery. Is it all arranged?
It's all arranged. But with such a big setup, what kind of surgery are you doing?
You'll see.
Everyone. After 3 years of preparation, our plan to enter the Solaris market is in its final stage. Although Solaris's healthcare sector is growing at 12% annually, but their local technology is lagging, and the market is fragmented. This presents us with a huge opportunity. Our targets are these 7 leading companies. Once we acquire them, we'll be able to secure the Solaris medical market's 60% market share. Especially this one, Linden Pharmaceuticals. Linden Healthcare Group, Solaris's traditional pharma leader. In recent years, they've started expanding into high-end medical devices. Their core subsidiaries, there are 3 in total, and these 3 companies will be our primary targets. We've allied with multiple investment banks for a 3-pronged attack. I believe in less than a month, the renowned Linden Group will be forced to sell their core assets. And the other Solaris companies, seeing their leader fall, will inevitably be plunged into massive panic.
Linden Group's data. We've analyzed it. Their cash flow won't last a month.
Their internal board of directors is currently in turmoil. As far as I know, even the current CEO is still lying in the hospital. Right now is the perfect time for us to strike.
So, they're absolutely doomed this time.
Once we take down Linden Group, we'll be able to build our production base in Solaris. Costs will drop by 35%, and within 5 years, our profits will quadruple.
Those local Solaris companies are at least a decade behind us in tech. Once we secure our foothold, we'll take our time playing with them. Everyone, is the champagne ready? In just a month, the entire Solaris market will be all ours.
My life is in your hands.
Aunt Olivia, don't worry. Found it. In my past life, Aunt Olivia was killed by this tiny tumor. In this life, I will never allow my family to suffer from any illness. Aunt Olivia, I will cure you.
The takedown begins.
Bad news, Chairman Clark. Our stock is under attack.
Young Linden called it. MedTech Inc. was plotting this all along.
The selling pressure is too heavy. We can't hold on much longer. What do we do?
Hold steady. Trust in young Linden. This first wave, no matter what, we must hold the line. Young Linden, MedTech Inc. has made their move. They're driving down our stock price.
I got it.
On Olivia. They've made their move. But don't worry. I'm ready for them. Dean Warren, go live nationwide.
Understood.
Isn't it just a craniotomy? Why such a huge fuss? They even invited us over.
Who knows? Word is St. Easton specifically requested this. 100 top-tier hospitals broadcasting it live.
Putting on such a huge show. If the surgery fails later, it'll be a massive joke.
Is this the doctor who did the barehanded hemostasis?
Yeah, that's him. Our hospital even sent him an invitation for surgery.
Weird. Craniotomies don't typically require major hemostasis.
Who knows? Who cares?
CEO. Our opponent this time, CEO Olivia Linden of Linden Group, is undergoing brain surgery. This surgery is being broadcasted live nationwide.
Pitiful. Seeing the company about to go bankrupt, she herself can only lie in a hospital bed, helpless. Even if her surgery is successful, what does it matter? She'll wake up to see the company has gone bankrupt. She might just die from pure anger. By then, Linden Group will be leaderless. It'll be the perfect opportunity for us to strike.
Early congratulations, boss, on taking the Solaris market.
Wait. Leave it on. I actually want to see what the medical standards in Solaris are really like these days.
I found it.
This location, one slip up could damage the speech center.
But his approach is spot on. He completely avoided the functional areas.
That technique? Without 20 years of experience, it's absolutely impossible.
Located in the left frontal lobe, no obvious adhesion to surrounding tissues. Increase suction. Prepare for tumor dissection. Feeding vessels are isolated. Prepare to coagulate and cut.
Look at that cut!
Right on the tumor's edge, there's a perforator artery.
One wrong move and it'll rupture.
But that cut avoided it flawlessly.
Is he really a fresh graduate?
This level of vascular precision without 20 years of microsurgery experience, it's just impossible.
Plus, his pace is incredibly fast, yet every step is terrifyingly steady.
The quality of this surgery, even as a training video, it would be totally perfect.
From the choice of approach to vascular management, every step is totally textbook.
St. Easton organizing this live broadcast viewing. They probably just want the hospital's next batch of top talents to show their faces.
Not necessarily. As far as I know, the one doing the surgery is no ordinary guy.
Then who is it?
He's the future heir of Linden Pharma.
Linden Pharma? That's our state's largest medical group.
Right, it's Linden Healthcare Group. I bought some Linden Healthcare Group stock. Look at this. Starting from noon, Linden Healthcare Group stock has been tanking.
What's going on?
I'm afraid this surgery is far from ordinary.
This kind of surgical skill, indeed, makes him a qualified doctor.
But no matter how good he is, what's the use? Linden Healthcare Group today will definitely crash. Double down. Keep targeting them.
Understood.
Linden Healthcare Group will be mine.
The tumor is completely extracted.
This surgery is a success. The tumor was in such a tricky spot. To remove it entirely is simply a miracle.
Now we just have to see if the removal was thorough and how the recovery goes.
It's finally a success. Wait. Why isn't he closing up?
The longer the surgery, the higher the infection risk. What is Dr. Linden doing?
Dr. Linden, the tumor has been removed. Time to close the skull.
By now, MedTech Global must think they've already won. What is he waiting for? If he doesn't close the skull, prolonged anesthesia is way too risky. Send it to pathology.
To pathology? He didn't close the skull. Does he want to wait for the pathology results?
Impossible. Traditional pathology results take at least half an hour. The patient can't wait that long.
In a craniotomy, the longer the wound is exposed, the risk of infection also increases.
Intraoperative testing. So many surgeons dream of this technique, but our current analyzer's speed...
Even if he wants a test, we just don't have the tech. By the time we get the results, it'll be way too late.
Wait! Look! What's that?
This is Wellspring Medical's newly developed ultra-fast intraoperative molecular pathology analyzer. With this device, you can, during surgery, test tissue slices in real time and output in 3 minutes molecular pathology results with 99.7% accuracy. With it, doctors can determine during the surgery if the tissue excision is complete, increasing post-op survival rates. 3 minutes?
Impossible. Absolutely impossible.
If this is real, for the patients, it would be huge news.
Real-time intra-op testing. Precise excision. It could save patients from a second surgery. This is a blessing for all of humanity.
Results in 3 minutes? How is that even possible?
Wellspring Medical. How did they pull this off?
If this tech is real, it will completely change the landscape of surgery.
Intra-op pathology testing. This is every surgeon's dream come true.
If this is for real, I want to be the first to get it. Intraoperative biopsy. What is this kid up to?
Outputting in 3 minutes. Molecular pathology results with 99.7% accuracy.
What?
Intraoperative pathology analyzer. Results in 3 minutes. This technology.
Could this be Linden Pharma's counterattack?
How is this possible? This kind of technology. Our group is still in the R&D phase. Investigate. Find out everything about this device. What is going on?
Understood.
Even if they have this patent, so what? Do they think I wouldn't dare attack Linden Healthcare Group? Keep pushing. Pour in more capital. Linden Healthcare Group must tank today.
But sir, they're fighting back too hard.
No buts! Dump it! Linden Healthcare Group. You can't escape my grasp.
The results are out. The tumor is completely removed. Clear margins, no residue.
That's great.
Clear margins. This means after surgery, the recurrence rate is very low.
This technology will save so many lives.
With this machine, future cancer surgeries won't be a gamble anymore. These patients have hope. Did you hear that? Intra-op pathology. Results in 3 minutes.
What does this mean? It means for tumor removals, we won't have to worry about leaving anything behind.
This device is an absolute lifesaver.
I get it now. No wonder Linden's stock has been dropping since noon. Someone is shorting them.
Linden Pharma is being targeted. Could it be someone is trying to steal the fruits of our medical industry?
Foreign corporations. It has to be them. They saw our technology as leading the nation, and they want to rob us blind.
We absolutely can't let foreign capital win. No matter what it takes, we must save Linden Group.
So what do we do?
Notify the dean right away. Have him ask our partner medical companies to lend a hand.
Exactly. Whoever is targeting Linden, we have to back them up.
Young Linden, the surgery was a huge success. You're practically my...
How's Linden doing?
Mr. Linden, look! A massive amount of funds just poured into Linden. Retail investors, industry peers, everyone's chipping in to help.
This is a miracle.
Bad news, CEO. Linden's stock is being driven up.
What? How is this possible? We clearly had the capital advantage.
Look at these buy orders. Retail investors, institutions, and even other medical companies in Solaris.
They joined forces.
CEO, not only are they driving up the stock, they're fighting back. We're losing too much if this continues.
Shut your mouth! Linden. Ethan Linden. I won't forget this. Retreat! Retreat!
Linden is safe. Linden's true mission is saving lives. We can't let foreign capital turn the healthcare industry into a ruthless monopoly just to get rich.